Welcome to AETCM, the Emergency Medicine channel. Myself Dr. CECIL. I am presenting today the types and classification of shocks as a part of EM Rapid 2024. So what is a shock? Shock is a state of tissue hypoperfusion, that is a state of circulatory insufficiency that creates an imbalance between the tissue oxygen supply and demand, resulting in end organ dysfunction. Reduction in ineffective perfusion may be due to global or local delivery deficiencies or utilization deficiency with suboptimal substrate at the level of cellular or subcellular levels. Effects of shock are initially reversible, but rapidly it becomes irreversible and can result in multi-organ failure, and it may cause death. So coming to pathophysiology of the shock, there will be reduced tissue perfusion and or increased oxygen consumption, and it may cause cellular hypoxia, which may cause cellular membrane ion pump dysfunction, which causes, that is, intercellular edema. The components of contents of the intercellular contents may be leaked to the extracellular space. Then intracellular pH alterations. It may cause acidosis and endothelial dysfunction, and it stimulates the inflammatory and anti-inflammatory cascades. So the physiological determinants of tissue perfusion is mainly dependent on cardiac output and systemic vascular resistance. That is, the BP or BP is controlled mainly by cardiac output and systemic vascular resistance, and in turn cardiac output is mainly heart rate and stroke volume dependent. Stroke volume is determined by preload, myocardial contractility and afterload, and systemic vascular resistance is mainly governed by vessel length, blood viscosity and vessel diameter. So what are the stages of shock? There are three stages, that is pre-shock, shock and end organ dysfunction. Pre-shock is also known as cryptic shock or compensated shock. That is, there will be compensatory responses to the tissue hypoperfusion, like tachycardia, modest changes in BP, mild to moderate hyperlactemia may be the only first initial symptoms. With timely and appropriate management, the deterioration can be prevented. Then coming to the stage of shock, that is, there will be signs and symptoms of the organ dysfunction to appear: tachycardia, dyspnea, restlessness, diaphoresis, metabolic acidosis, hypotension, oliguria and cool clammy skin. Then coming to third stage, that is end organ dysfunction, that is the progressive shock. From the pre-shock it may progress to shock and then to end organ dysfunction. So progressive shock leads to irreversible end organ damage and multi-organ failure and death. So types of shocks are, there are four types of shock, that is hypovolemic, distributive, cardiogenic and obstructive. Coming to hypovolemic shock, hypovolemic shock is increased intravascular fluid, decreased intravascular fluid or decreased blood volume. It may cause decreased preload, stroke volume and cardiac output. In severe hemorrhage, there will be decreased myocardial oxygenation, decreases the contractility and cardiac output, and which increase the autonomic increase in systemic vascular resistance will occur. Coming to distributive shock, it may cause systemic vasodilatation, which causes relative intravascular volume depletion, that is shock, and decreased systemic vascular resistance, which causes compensatory increase in cardiac output and tachycardia. Coming to cardiogenic shock, when the left ventricle fails to contract, that is mainly in MI, and bradyarrhythmia, decreased cardiac output will occur. Tachyarrhythmia, there will be decreased preload and stroke volume. Then coming to obstructive shock, due to decrease in venous return or marked preload decrease. So these are the categories of shock, that is distributive, hypovolemic, cardiogenic and obstructive. The percentage is mainly, commonly it is distributive 30 to 50% and hypovolemic 31 to 36%, cardiogenic 14 to 29% and obstructive is the least common, that is 1%. The hemodynamic changes will be, in distributive shock there will be decreased preload, decreased systemic vascular resistance and mixed cardiac output. The etiologies will be sepsis, neurogenic shock and anaphylaxis. Then coming to hypovolemic, the hemodynamic changes will be decreased preload, increased systemic vascular resistance and decreased cardiac output. In cardiogenic, there will be increased preload and increased afterload, increased systemic vascular resistance and decreased cardiac output. Obstructive shock decreases the preload and increased systemic vascular resistance, decreased cardiac output. So this classification, distributive shock is classified as septic and non-septic. Septic, it is mainly due to gram positive, gram negative, fungus, viral, parasitic, mycobacterium, anything. Then non-septic will be inflammatory shock like burns, trauma, pancreatitis, and neurogenic shock like traumatic brain injury, spinal cord injury. There will be quadriparesis with bradycardia or paraplegia with tachycardia. That is the main highlight in the neurogenic shock. Then anaphylactic shock, which is IgE mediated. It will be caused by food, medications, insect bites or stings. Then IgE independent will be iron dextran and non-immunological. And other causes may be liver failure, transfusion reactions, toxic shock syndromes. The next one is cardiogenic. Cardiogenesis is divided into cardiomyopathic, arrhythmogenic and mechanical. Cardiomyopathic is mainly myocardial infarction, severe right ventricle infarction, acute exacerbation of severe heart failure, and advanced septic shocks, myocarditis, myocardial contusions during trauma and drug induced. Arrhythmogenic can be tachyarrhythmia and bradyarrhythmia, and mechanical may be severe valvular insufficiencies. Coming to hypovolemic, hypovolemic may be hemorrhagic and non-hemorrhagic. Hemorrhagic may be due to trauma, GI bleed, that is varicose bleed in CLDs, intraoperative and postoperative bleeding. Any type of hypovolemia, that is bleeding manifestation, will be coming in hemorrhagic shock. And non-hemorrhagic shock will be GI losses like diarrhea, vomiting, external drainage, and skin losses like heat stroke, burns, renal losses like excessive drug induced or osmotic diuresis, and third space losses into extravascular space or body cavities like intestinal obstruction, crush injury, pancreatitis, cirrhosis, everything. Then coming to last, obstructive. Obstructive is pulmonary, vascular and mechanical. Pulmonary vascular means hemodynamic significant pulmonary embolism, severe pulmonary hypertension, severe or acute obstruction of pulmonary or tricuspid valves, and venous air embolism. Mechanisms will be, first is mechanical will be tension pneumothorax or hemothorax, and pericardial tamponade, constrictive pericarditis, restrictive pericarditis, severe dynamic hyperinflation, left or right ventricular outflow tract obstruction, and abdominal compartment syndrome, aortocaval compressions. This is about the shock types and classification. Thank you.